Donald Trump has ever told about health care.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. What my plan is that I want to take care of everybody. I'm not going to leave the lower 20% that can't afford insurance. Obamacare is collapsing, and we must act decisively to protect all Americans.
Douglas Elmendorf. Joining us now, Douglas Elmendorf, American economist and dean and professor of public policy at Harvard Kennedy School. He was the director of the Congressional Budget Office from 2009 to 2015. Also with us, Andy Slavitt, former acting administrator of the Centers for Medicare and Medicaid Services from 2015 to 2017. Doug Elmendorf, you've been through these CBO estimates for healthcare plans. You can't envy the CBO having to struggle with this one. I want to get your reaction to what CBO projected today about this plan.
Well, the Congressional Budget Office estimated that the number of Americans without health insurance would essentially double under this proposal, reversing all of the gains from the Affordable Care Act. At the same time, the federal government would save a lot of money on health insurance subsidies, which this legislation would use partly to roll back the tax increases in the Affordable Care Act, give more money back to higher income people, and partly to reduce federal borrowing.
And part of the way they save money is people who are subsidized up to amounts of, say, $12,000, $13,000 would only get a subsidy, if they got a subsidy at all, of $4,000 or less.
Right, so the subsidies people can get through these insurance marketplaces would fall by about half by the end of the 10-year window that CBO does its projections for. And even more importantly, a lot of people would lose Medicaid coverage because of the cutback in Medicaid spending. So through both the insurance marketplaces and through Medicaid, people would lose access to health insurance.
Andy Slavitt, let's get your reaction to the Medicaid piece of what you're hearing in this proposal.
Yeah, well, thank you, Lawrence. I think the simplest way to look at this proposal, the CBO verifies this, is we're cutting Medicaid by about 25%. And to remind everybody what Medicaid does, Medicaid is a program that takes care of kids, low-income people, seniors in long-term care, and people who live with disabilities. That's it. So when you cut 25% from that, you really leave governors and states with very, very stark choices over which of those sets of people aren't going to get benefits, because states, as we know, have to balance their budgets every year, and with a cap...
The federal government needs to balance its budget too.
They're not just cutting by 25%, but then they're saying we're going to limit the growth of Medicaid going forward. And of course, as I think you said earlier, and as
the numbers don't work.
For about an $800 billion tax cut for corporations and wealthy Americans.
And one of the things that Sean Spicer kept saying today, Republicans keep saying, is that people who have coverage now under the Affordable Care Act don't really have anything. Doug Elmendorf, the way Sean Spicer kept saying it today, is they may have a card, but they can't go to the doctors won't accept them. The doctors won't accept Medicaid patients. What is the truth about the interaction with the healthcare system that beneficiaries of the Affordable Care Act experience when they try to get services?
People who have health insurance are more likely to be able to see a doctor when they need one. There's plenty of evidence about that. So these people who have gained health insurance through the Affordable Care Act have better access to doctors than they would have without health insurance. And if they go ahead with this proposal and those people lose health insurance, they will lose access to doctors that they have today.
Andy Slavitt, you've overseen the Medicaid program in particular. Today, Sean Spicer was saying that people on Medicare cannot get physician services because physicians turn down Medicare, but he was stressing that they turn down Medicaid patients all the time. What's the truth of that? What does that mean for Medicaid patients?
Well, the truth is that the Medicaid program and the Medicare program are two of the most highly valued programs in our country. You know, prior to Medicare and Medicaid, 1 in 3 seniors in this country live below the poverty level. 1 in 3. You know, today, because of Medicare and Medicaid, that's less than 1 in 10. These these are really phenomenal programs. They've changed the country, and they've done that in ways that have glowing popularity. I think over 70% for Medicaid, close to 90% for
What
Medicare.
affects one person affects us all.
Taken care of. And I think
We are
have to remember
one.
That half the kids in this country that are born are paid for.
We are all
through the Medicaid
interconnected,
program.
guys.
And we have to really decide.
We
as
have
a
to take care of
country
each other.
to pass
Hello.
legislation that strips away all the funding to take care of all the kids that are born in this country, that are born healthy, in order for this very large tax cut.
Yeah, and the Republicans in their responses to this seem to be pretending that all Americans get to choose any doctor they want at any time, when in fact most of us have insurance plans that some doctors do not participate in and some doctors actually reject. And so the idea that everyone has the choice of any physician they want isn't true to begin with. I want to go to this point about premiums, and there's an indication in the CBO report that in the long run of this legislation, some premiums on the individual market would go down, or I shouldn't put this correctly, they would not increase as much as they would increase under the Affordable Care Act. But the report says in that spot that
Look
this
at their
is
faces.
partially
Look at the
because
experts' faces.
of the change in the requirements for the health care plans that would be sold. And Doug Elmendorf, what they mean by that is these plans will be cheaper because they will have less benefits in them, and also young people can be charged a lot less for these health plans, and that older people will be charged much, much more. The older people's premiums will...
Guys, we got to take care of our parents, because we're going to be our parents' age before we know it.
One is, as you say, that because of a relaxation of rules in this legislation, health insurance plans would cover a smaller share of people's total costs. So part of the reason that premiums would go down is because people's out-of-pocket payments would go up. That doesn't make them better off on average. Those who don't get sick that year will be better off with lower premiums. Those who do get sick would pay more out-of-pocket. So on average, this reduction in the number of healthcare services, the amount of healthcare covered by the insurance plans, with lower premiums, but people would pay some of that out-of-pocket themselves. In addition to that, there is a change in the age structure of premiums. Under the Affordable Care Act, insurers can only charge older Americans 3 times what they charge younger Americans for these plans and insurance exchanges. Under this legislation, insurers could charge 5 times as much for older Americans as younger Americans. That'll tend to push up healthcare insurance premiums for older Americans substantially. So some younger Americans would have lower premiums under this legislation, but older Americans would have higher premiums and pay more in deductibles and co-payments when they need health care.
As Donald Trump has discovered, it's complicated. Douglas Elmendorf...
Yes, it's extremely complicated. That's why they need to use what they had and fix it.
Coming up, congressional
They put a lot of work into the ACA.
of just how many people lose coverage under the health care bill. And
I want the best for America. I sincerely do. I know that our representatives can do better.
Why he accused President Obama.
I can't film anymore tonight. I'm sure there'll be lots of news stories tomorrow about all this.